So Carmen, we've had some interesting news today about some of the treatments for secondary progressive patients. What are your thoughts on this new treatment that's going to be available?
Yes, thank you very much. Actually, this is a very important trial. So, I mean, we don't have any treatment so far for secondary progressive MS, and all the efforts are welcome, and especially if the trial is positive. So, this is a very important trial to highlight. And this is about siponimod, which is a molecule that is very similar to fingolimod, and it has shown a benefit in progression of disability in secondary progressive MS patients. So I don't know when it's going to be available. The good thing is that the safety profile was very good, and so of course this will help the process, and hopefully it will be in the market. Of course, that will. We will need more data, but if everything goes fine, it is possible that it's in the market fairly soon, I suppose.
Great. So, thank you, Carmen. I myself, I take fingolimod as a treatment, and I find it to be very effective. Um, do you see how do you find it in people that you interact with as a treatment, and then do you see any other application anywhere else for other people, perhaps?
Okay. Fingolimod is, as I said, siponimod is a very similar molecule to fingolimod, and fingolimod is very efficacious in relapsing remitting MS, as you know, and also is fairly well tolerated. And unfortunately, fingolimod was tried in primary progressive MS, and the results of the trial were negative. This, of course, raises some concerns because if siponimod is so similar to fingolimod and fingolimod doesn't work in primary progressive MS, we were wondering, and actually one of the questions in the audience was in that respect. Are we going to expect also another positive trial with siponimod in another trial in secondary progressive MS? Or we are going to find a negative trial then, as it has happened with other drugs in the past. And of course, we don't know what's going to happen. So, it is possible that it works very well in people with progressive MS who have maybe some inflammatory activity, and maybe it doesn't work that well in people where the predominant process is more like the neurodegeneration rather than inflammation. So still, as I said, this is a very good trial, but we need more data to confirm the efficacy of this trial in progressive MS, of this drug in progressive MS.
Great, thank you.
Welcome.